65-year-old woman comes to the physician because of progressive weight loss for 3 months. Physical exam shows jaundice and a non-tender palpable gallbladder. A CT scan of the abdomen shows an ill-defined mass in the pancreatic head. She is scheduled for surgery to resect the pancreatic head distal to stomach, duodenum, and early jejunum, gallbladder, and common bile duct, and anastomosis of the jejunum to the remaining stomach, pancreas, and bile duct. Okay, so following surgery, this patient is at greatest risk, long-term risk for which of the following? Option A, hypercoagulable state. Option B, microcytic anemia. Option C, calcium oxalate kidney stones. D, white-based gait. And E, increased bile production. So what happens, like whenever you remove ileum, what is the function of ileum in your body? Ileum is responsible for absorption of bile, enterohepatic circulation. I'm not sure whether you have heard it or not. So what happens that from liver, bile comes into the second part of duodenum, and then it helps in absorption of fat. It causes emulsification of the fat, and then from ileum, 80% of the bile I'll reabsorb, and only 20% is excreted. Okay, so it is called enterohepatic circulation. So whenever you remove the ileum, so what's going to happen? Now you are no more, your body is no more reabsorbing bile. So if you remove the ileum, your body is no more reabsorbing the bile. So what can happen? There is defective absorption. You will have deficiency of bile. So bile. So what will happen? What's going to happen? It's going to happen that all the patient will have steatorrhea. They cannot digest their fat. They cannot emulsify their fat, due to which there will be steatorrhea. Along with that, what happens? The fat combines with the calcium. The fat combines with the calcium, and they are excreted. So calcium is being excreted. The patient might have deficiency of calcium. So keep it in mind. If there is ileum has been removed, the patient can have deficiency of calcium as well. And since there's problem with fat, they're going to have deficiency of what more else? Let me first clear your concept regarding fat soluble vitamins. So since there is fat is being excreted in the stool, the patient will have deficiency of fat soluble vitamins as well. Why not macrocytic anemia? So what happens if you stop taking vitamin B12 from now? Then only after 3 to 4 years you're going to have deficiency of vitamin B12 in your body, because the store of vitamin B12 lasts longer. Okay, if you stop taking folic acid and vitamin B12 from today, then probably after 6 months you will have deficiency of folic acid, but not vitamin B12. Okay, it takes 4 to 5 years, okay, to be deficient, because we have enough store in our body. So it has been just 3 months, no? So the patient went under surgery recently, so we will not have vitamin B12 deficiency. Okay, in this case, if it prolonged more than 5 years, more than 4 years, then you're going to have vitamin B12 deficiency. Okay, so those stores which are very deficient, you're going to have deficiency of only those stores. Okay, so now let's give a read. So patient without duodenum are prone to develop iron deficiency, as iron is solely absorbed in the part of GI tract. Iron deficiency in turn leads to microcytic hypochromic anemia, which is why this patient may require intravenous iron supplement. You can't give oral supplement, because if you give oral supplement, it's going to be excreted in the stool. Okay, so you need to give IV supplementation. Okay, the why option A is incorrect. So a hypercoagulable state may either result from inherited gene mutation or insufficient inhibitors of the coagulation cascade, both of which this patient does not have. However, Whipple procedure involves resection of the first part of jejunum, which is responsible for absorption of vitamin K. This may actually contribute to the development of coagulopathy due to deficiency of vitamin K dependent clotting factor. So option A here is saying hypercoagulable state. So it is, you are not going to observe hypercoagulable state, because I said If you don't have ileum, you're going to lose the fat in the stool. So what happens? There's deficiency of fat soluble vitamins. So ADEK, K is one of the fat soluble vitamins. So the patient might have deficiency of vitamin K, okay? And if there is vitamin K deficiency, he is not going to synthesize 2,7-9-10 factor. So patient can have bleeding disorder rather than hypercoagulable, okay? So now option, why not option C? That's very interesting. Option C, why not? So calcium absorption is mediated through active transport and passive diffusion, with the greatest amount being absorbed in the duodenum. When this patient duodenum is removed, she will have diminished intestinal calcium uptake, which leads to increased reabsorption of calcium in the kidney to maintain normal serum level. As a result, urinary calcium is low, which decreases the likelihood of calcium. Once you remove the ileum, so what happens? The fat which we consume every day, the patient, when they consume the fat, it is not being absorbed. No, whenever the fat is not absorbed, this fat will combine with calcium, and calcium will be excreted in the stool, okay? At the same time, so we consume every day a lot of fruits, vegetable, and fruits and vegetables are a good source of oxalic acid, okay? And your body should not absorb all the oxalic acid, okay? So what happens? Whenever a patient eat a lot of fruits and vegetable, the oxalic acid combines with the calcium in the diet, and the oxalic acid, they form a salt, and that salt is excreted in the stool, and it does not allow the oxalic acid to be absorbed in the body, okay? So there is decreased oxalic acid level in the blood, due to which there is less chance of formation of calcium oxalate stone. But what happens whenever you remove the ileum? Now what happened? The calcium, which was responsible for forming the salt with oxalic acid and to be excreted in the stool, is now not available, because that calcium has combined with fatty acid. So there's no more calcium to be combined with oxalic acid, due to which what will happen? Oxalic acid is free, so to be absorbed in the circulation, and the oxalic acid will go into the circulation, and they will combine with the calcium, and they will precipitate in the kidney, and they're going to cause calcium stone. So calcium oxalate stone is the most common stone you're going to see in a patient of Crohn's disease, or a patient who has undergone surgery for ileum resection due to any cause, okay? And it is one of the famous question of real exam. So option D, the finding of white-based gate is commonly associated with long-standing vitamin B12 deficiency, which leads to diminished proprioception in the lower extremities. Common cause of vitamin B12 deficiency include pernicious anemia, malnutrition, gastrectomy, or Whipple procedure, as described in this case, would not alter vitamin B12 absorption, as in this vitamin is absorbed in the terminal ileum. Moreover, intrinsic factor function would also remain unaffected. Actually, I think in this question they are saying they have removed ileum. So ill-defined mass in the pancreatic, pancreatic stomach, duodenum, or jejunum, gallbladder. Okay. So the question is saying they have not tossed ileum. Okay, no worry. So if they have tossed ileum, then you're gonna have oxalate problem. Okay. So but here, even if you have removed the ileum, okay, you will not have deficiency of vitamin B12, because you have sufficient stores. Keep it in mind, okay? They're gonna ask you a question. A patient comes to you and he's trying to be a vegan, okay? So what do you suggest? If he's trying to be a vegan, don't directly click B12, okay? Because it's gonna take 5 years for vitamin B12 deficiency to develop, okay? So now, the incorrect answer is E. Bile acid plays a pivotal role in the metabolism of lipid and fat soluble vitamin, as well as cholesterol excretion. Bile excretion in the duodenum is stimulated by food intake, which is followed by reabsorption of 95% bile acid in the ileum. No, so I said more than 80%, so it's 95% are being reabsorbed, not in the duodenum. The cycle is known as enterohepatic circulation. Thus, bile synthesis remains unaffected by pancreatoduodenectomy. And I will correct myself that I said even ileum has been removed. So in this question, I missed the ileum is intact. Okay, so ileum is not removed. So since ileum is not removed, so what's going to happen? There's no problem with the bile salt, bile being reabsorbed. So he may not have vitamin B, fat soluble vitamin deficiency, and he may not have, like vitamin B12 deficiency. But even if you remove ileum, it's going to take time, but he may have vitamin, fat soluble vitamin B fat soluble vitamin deficiency. Okay, even if you remove ileum, they're gonna have fat soluble vitamin deficiency, but it's gonna take time for B12 to be B12 deficient. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.